and unanticipated staff absences. Department is requesting the approval of the contract amount of $5 million. Sorry, I covered all this already. The proposed total contract amount of $5 million includes $4,464,286 in services and $12,000 in the contingency of $535,714 applied through fiscal year 2023 through fiscal year 25-26. I wanted to add, based on a question we received earlier today, that these services are exclusively for radiology and include radiology technologists, CT technologists, sonographers, MRI technologists, and imaging assistants, schedulers, and transporters. If commissioners have any other questions, Valerie Williams, Assistant Director of Radiology, is here to respond.
No, that's great. Thank you. I was wondering how many of the radiology services were being served by these personnel, and in fact, you added CT, MRI, etc. is really helpful. And I see no other questions on this, and we can go on to our next contract.
Okay, thank you very much. The next requested action is approval of a contract amendment with Curry Senior Center, Substance Use and Mental Health, to increase the total contract amount with contingency to an amount of $9,984,434, and to extend the contract end date from 12/31/22 to 6/30/26, or an additional 5.5 years. The Health Commission previously approved this contract in February of 2018. The amendment is authorized under RFQ 5/2017, RFQ 32/2017, RFP 8/2017, and RFQ 26/2016. Please note the Senior Drop-In Center services under RFQ 5/2017 and the Behavioral Health Services and Primary Care RFQ 32/2017 do not extend through the entire term of the contract as the RFQ authority ends, and these services will be bid out. The department is requesting approval of the total contract with contingency as stated of $9,984,434, an increase of $5,334,816 to extend 5.5 years. The annual amount without contingency will increase by $145,793 per year, or about 11.45%. This is due to fiscal year 4% increase to the CODB and an MHSA 3% increase, and Prop C funding added for a substance use disorder navigator of about $111,000. In regard to the question submitted earlier today regarding the program meeting less than the contract objectives being met, and if the number of this reflected the number of clients being served, contracted performance measures are not related to UOS and UDC. They are the performance measures are indicated in the actual monitoring reports or in the summary of those as you have. So the answer to that question is no. The performance objectives are a different category, such as, for example, by June 30th of 20, limited English speaking services will be informally assessed. In that example, the objective was not met. Two of the Curry Center's programs are dependent on medical clinics referring clients, and they were not regularly scheduling clients during the pandemic, so referrals were down quite a bit to the drop-in clinic, which were also restricted. A lot of the clinics were also in shelter in place, so Curry had limited access to the clients. Jeanette Hua, the older adult system of care director, and Teresa Yu, the mental health services administration program manager, are here to respond to any additional questions you may have.
Thank you. In the units of service, it's a very extensive discussion there of the number of hours and minutes and so forth. If you're saying one or two of these programs would not be continued after a certain period of time, and I'm looking to see what that is. Oh yeah, the Senior Drop-In Center and the Behavioral Health Services in Primary Care do not extend. How then does it affect these, or is there a lowering of the amount then that is within those last 2 years of the contract?
Hi, this is Michelle Ruggles. Let me just answer
Hi,
that.
Michelle.
Hi.
Haven't seen you for a while.
Yeah, I hide behind.
Yeah.
So the UDCs and that unit information that hold those boxes, that's what's projected or budgeted right now. The total not to exceed amount with contingency, the 9,984,000, that accounts for the fact that in the out years, those services drop out. So when we put together that column, that amount, we looked at every year of the contract by program and then dropped out the one. So, and then they'll be put out to bid. If whoever's successful will have a standalone contract with those services in them. But yeah, so that's incorporated into the total funding.
Okay. No, that's helpful. So we know that what we're looking at is your contracted units of service, and as certain things get dropped off in those last years, then they're not paid for. They're not actually in the budget, and
Yeah.
or even if they are in the budget, they're not going to be expended.
Right, but so right now what you're looking at is units of service. It says 21, 22. So that was, so they haven't updated because they probably don't have the 22, 23 contract, but let's say it's essentially the same. So but I'm like forgetting exactly, but let's say that you got this back in 23, 24, then you wouldn't even see the senior drop-in center box. It would be completely gone because it wouldn't be part of the current year budget.
Okay. No, that's fine. Appreciate that. And I don't have any other questions about the center, and we can move on to our next contract, please.
Thank you, Commissioner Chow. The next requested action is the approval of a contract amendment with Curry Senior Center. Sorry, I missed that one. With Episcopal Community Services to increase the total contract amount with contingency to an amount of $17,739,962, and to extend the contract end date from 12/31/22 to 6/30/26, or an additional 5.5 years. Department is requesting approval of the total contract amount with contingency with an increase of $10,777,930 to extend those 5.5 years. The additional amount without contingency will increase by $386,000 or 22.24% due to a 3% increase in the CODB of about $40,500 to an HOM work order or Department of Homelessness and Supportive Housing work order, a Medi-Cal match of $332, and a fiscal year 22-23 general fund CODB increase of 4%. In response to the question received earlier today, to the work order and the Medi-Cal match added to the contract, what additional services could this provide? In fiscal year 22-23, there is an additional amount of $166,000 in work order funding from Homelessness and Supportive Housing, which is matched by the $166,000 in federal Medi-Cal for BHS to fund Episcopal Community Services to provide behavioral health services to the residents of a new permanent supportive housing site at 1064 Mission. In fiscal year 22-23, Episcopal Community Services has opened, will be opening the site of 256 permanent supportive housing units for 153 adults, and 103 of those are seniors over the age of 55. Commissioners have any further questions, Tomiko Aya, Program Manager with Adult and Older Adult Systems of Care, is here to respond.
Could you just elaborate a little about what that work order is finally going to do? I mean, what added service it is? I know that you mentioned it, but as I was reading all these numbers, I was still trying to understand, is that a new, I mean, it's a new program done in collaboration with another agency or another part of the city department, but what is it that we're delivering? so that I can tell the commissioners what we are delivering extra.
So this is Tamiko A. with Behavioral Health Services, Program Manager over Episcopal Community Services. They provide behavioral health services to this new permanent supportive housing site, which was which is opening, and basically they have been providing that same service to other sites throughout the city for homeless folks. So they're housing these people like from the closing of the shelter in place hotels and other agencies that are referring mostly from HSH, and they're being put in this very beautiful new building, which is housing seniors and also adults under the age of 55. So the behavioral health services are case management, mental health services, referrals to substance abuse programs. They also will have on-site nursing services and IHSS services. So it's a pretty much full service permanent supportive housing site. But their specific team will serve these folks who are moderately to severely mentally ill.
So where is this nice new building?
1064 and 1068 Mission. So this is monies through Prop 63, No Place Like Home. That was the first site that was awarded to them 2018. I sent through the document from MOCAD, who actually awarded them the money for this. So the site has been finished. It took a little longer than expected. Of course, like most things with the city do. So, but anyway, it's nice. It's great. They have a really great space for them.
Well, it sounds very nice, and that's really helpful, and we'll make note that this is the beginning of a brand new building with services that will really be an enhancement to what we've had in the I guess transient hotels and all. Right.
Correct. Thank you.
Thank you.
Thank you, Tamiko. Commissioner Chow, if you look on the Health Commission report under that item on the right side, where ECS behavioral health is indicated under the alongside the UOS and UDC rows, that there's a breakout there of the units, service, and the clients being served.
Oh, that's terrific. I just thought that was already part of your whole thing, but there it is. Yeah, 332,000. Okay. That's very nice. Thank you. Very thoughtful. Let's go on to the next one now. I'm learning so much today.
Cool. Next, we have approval of a contract amendment with Health Right 360 for Summarize, formerly Drug Sobering Center, to increase the total contract amount with contingency to an amount of $9,875,729, and to extend the contract end date from 12/31/22 for 1 year to 12/31/23. The Health Commission previously approved the subject contract in June of 21. The amendment is authorized under a 2142 sole source. I have several notes on this. The department brought this contract to the Health Commission initially in June of 2021 for a new contract, which you approved for the term of 7/1/21 through 12/31/22, or for 18 months. And this included a Prop I hearing. However, the final certification of the actual contract was delayed for several administrative and planning reasons and wasn't certified until February of 2022. Due to the delay, an administrative decision was made at the tail end of the processing to tack on an additional year to the term, so we wouldn't need to immediately turn around and process an amendment. New contracts and amendments have longer processing time, and this decision was made for expediency reasons, and to add the additional year to end in 12/31/23. As we were reviewing the Health Commission approvals that were due, this contract was flagged due to the Health Commission approval period ending at the end of this month. It was during the preparation that we realized the disconnect between what the Health Commission approved and what was in the actual contract. This is not a common occurrence, but we wanted to be transparent about this error. We now have a permanent director of the contracting unit here at 1380 Howard, Phil Bach, who will help to ensure alignment between contract development and the Health Commission approvals. So before you today, we are requesting your retroactive approval to extend the contract by 1 year and the associated amount I've already described. The contract was created for the Silma Rise, also known as the Drug Sobering Center, located at 1076 Howard Street. Due to the delays in readying the building and therefore the implementation of the programming at the site, HR 360 was able to redirect the staff that were hired for Silma Rise to the Tender Linkage site instead. TLC is closing down operations, or they closed this past Sunday. Silma Rise will open in projected potentially in June. This service is going out to bid, so this extension allows us time to operate the new program and conduct that solicitation. In relation to the unit cost of services presented in the Health Commission report, the calculation was based on an average of 8 clients on site, an average length of stay of 8 hours. In actuality, 1,015 client encounters, or about 33.6 per day, with each participant having an average length of stay of about 9 hours is what occurred. In October of 2022, it's about 830 client encounters, or 26.8 per day, and each participant had an average length of stay of about 13 hours. Basically, conceptually, we are seeing more clients than what the contract had initially projected, and the clients are staying longer. I'll turn this over to my program colleague, Dr. David Pading of BHS Addiction Psychiatry and Substance Use Services, to speak to the services that are now being offered at 1076 Howard, and as they compare to those at the Tenderloin Linkage Center site location.
Hi, Dr. Chow. This is David Pading, the interim medical director for substance use. The Silma Rise Center is up and running at 1076 Howard. It's been operating 24 hours a day for since September, following its partial opening in the end of June. At that time, since then they've been seeing about 900 to 1,000 clients a month. With stays a little longer than we thought, but we've been having positive responses from our key partners, which is the street crisis centers, response teams, the paramedic teams on EMS and EMS 6, as well as other agencies that have been referring to this place as a bridge to detox services. So let's see, what else can I tell you? At this program, people receive a rest while they're coming down from substance use, as well as hospitality services like showers and food as needed. We're asking for funding for 1 additional year, at which time we will complete an evaluation of the program, whether it's met its goals of reducing mental health and substance crisis on the street, as well as being a safe drop-off for our emergency response teams. And then if it is successful, we would be putting out an RFP, hopefully to be fulfilled by the December 31st, 2023, so we can continue services into the subsequent year. So again, this is a pilot. We're asking 1 year extension, and then we will do the study and an RFP during this year.
Thank you. Well, it's nice to, while we can't see you, David, that our former commissioner is now also providing direct services to our patients. So thank you so much for your continued work on behalf of our San Franciscans who are in need. Can you just tell me then what services that TLC offers that it sounds like most of what they're offering you have over at Silma Rise. Is that right? Or what are we not doing? And it sounds like we've already been transitioning a number of people over there.
So Silma Rise is meant has, it's not a drop-in or a lounge model in the way that the Tenderloin Center took everybody to be able to come and find respite off the street. It is specifically for individuals that are intoxicated from substances, that need some respite from having a substance-induced crisis. You're right that we offer similar hospitality services, food and showers, because that's when what we've learned from the Linkage Center is most requested from from um, from street level services. But our goal again is to bring people in and help them to link to services more immediately. We have a EMT on service that can provide health screening, and we have our street crisis teams bringing people in and then linking them in the morning to follow up care. So it's much more integrated with the flow of clients through our health system than the TL was. But we've learned many lessons from the Linkage Center, and there's staff that has come over, which has brought those lessons, which has been great.
That sounds like a transitioning from lessons learned, as you say, from TLC, and taking parts of that in order to work on behalf of people who are, as you say, what, intoxicated or with other substance use problems. And so there's that linkage, the hospitality services. I'm just trying to picture that, because, as you know, the papers recently have been it's sort of an interesting set of articles, right? They first describe why it's a failure, and then they describe why it's really sort of needed. and but it sounds like this is sort of the next generation of trying to get to answer our problems with this particular population. Would you think that was you know a reasonable sort of inference from this?
Well, definitely. First of all, I want to say we do not have any sort of safe consumption or illicit use on the premises. This is a drug-free environment. It doesn't mean that people sneak things in, but they are told if if they want to stay, they cannot use any substances on this premise. So that's different. Well, I won't say that it's different. I would publicly, but I would just say that's different than some people may believe had been happening at the Linkage Center. Um, the the second thing is we are more integrated with fire and EMS and these our street alternative responses to police interventions for crisis. And so that is a difference. And we're trying to continue to refine this sweet spot of people that really need it versus people that are looking for simply shelter through the night. So these are lessons that we'll learn that hopefully we can maybe share with you and the the rest of our departments after we complete our initial study of the operations for, well, if you fund us, it would be another year.
Wonderful. Well, I'm hoping that we'll have a chance to learn more about this. I'll ask Mark how we can do that, because I think this is of interest for all the commissioners, and maybe it goes to our other committee, because it wouldn't be so much finance. But I really appreciate you coming back to the city and actually working on behalf of our department. So nice to see you. It's been a little while, and thank you very much for this very helpful update on the summer rise.
Well, you are my inspiration, Dr. Chow, as you know that. So thank you very much. Mark, too.
Okay, uh, thank you, Dr. Davis. That was very helpful. And can we go on to our next contract, please?
Yes, yes. Next, we have a requested action for the retroactive approval of a contract amendment with the Mission Council on Alcohol Abuse for the Spanish-speaking to increase the total contract amount with contingency to an amount of $6,867,000 and $4 to extend the contract end date from 6/30/22 to 6/30/27, or an additional 5 years. The Health Commission previously approved this in February of 2018. The amendment is authorized under RFP 26-2016. The department is seeking approval to continue this contract retroactively due to a scheduling oversight caused by contract analyst staff turnover and transitions in the spring of 2022. This contract amount with contingency of $6,867,004 is an increase of $3,607,352 to extend 5 years. The annual amount without contingency will increase by $96,721, or nearly 11.6%, due to a 3% cost of doing business, an increase of 4% cost of doing business, and an addition of Prop C funding for a navigator of about $67,000. Earlier today, we received a question about the monitoring report showing that the program's declaration of compliance was not filed, and what is the consequence of not filing this. Responding to and submitting a signed declaration of compliance is worth 5 points out of 40 possible points from the program compliance section of a BOCC monitoring report. So failure to submit this document results in a loss of these 5 points. If Commissioner has any further questions, David Pating is here to respond to this as well.
All right, so it sounds like that declaration of compliance is not very important, or it's
5 points out of 40 can be significant for a program, when they're on the cusp of being on the edge of being commendable or acceptable or
oh, I see. Okay, well, I mean, you're
So
right.
5% of the total score.
Yeah.
Michelle, did you want to add
And-
something?
If it's okay, I'd just like to add a comment also. Because we don't have a director of BOCC right now, so that's me. But I think it is important, and they've been trying to put more teeth in it by assigning points for not turning it in. Ironically, or not, I don't know if that's the right word, because it was COVID, there's no scoring of the category, so it's a little bit moot. But in a desk audit, you can't check everything. And so that makes it even more important. But normally the audits are done on site. And so you can actually look in there, like, did they hang up their posters, and they'll look and see. So with COVID gone, they'll be returning back to on site. But I do think it's important. It does, it's had score added or points added. So it does impact the score. And I wasn't able before the meeting to touch base with the exact program analyst who did the monitoring for this program to find out if there was a backstory or something going on about that. But I would say it is important. And at this point, it's just looking at, like, I wanted to find out what the follow-up was, or is it just do it next time? But I think it's less of a concern when now we're going back to on-site monitoring. It's still a concern. They should do it, but on-site, we can double check it in person.
Right. And COVID isn't entirely gone, but we are moving
Right.
towards a more normal relationship with
Right.
our contractors, right?
Yes.
And holding them responsible at this point, which
Hi, this is David.
yeah.
During COVID, our outpatient programs, particularly this one and another one called Horizon, had really a difficult time with staffing. They're beginning to come back to normal, and we can offer them technical assistance once our BOCC compliance experts go through again, perhaps, and look. But they are just getting on their feet again, and this is really an essential contract expansion, and we hope that would allow us to continue to work with them. They're a good agency, and it was very difficult the last 2 years for them.
No, very nice discussion about that, and we know that agencies like this certainly have been going through a real problem, and certainly COVID has not helped, and which is one reason for having suspended the scoring. But and really appreciate that there is a feeling that we are going to try to help all of our agencies, particularly those that are really unique to our system and are really important in order to reach the population that we're trying to reach. I remember we had the same problem many years ago with Rams, and look at them today. So I can appreciate that there is a real effort to work with them and try to help them to be able to continue the services to this very important community. So thank you.
Could I ask a quick follow-up question, Commissioner? Dr. Pading and or Michelle, do y'all know when the next monitoring will take place? Because I can make a note for the committee to be updated so that this doesn't go too long for the committee to, hear some performance metrics. Any
We
idea?
can find out an answer to I don't think the monitoring for 21, 22 for substance abuse will be able to start until, oh, you know what? It'll be done by the end of February, or it's supposed to be.
So I'll make a note to check. I'll personally make a note to check with you in March, and then maybe we can come back to the committee in May or June or something. Okay, thank you.
No, thank you. I think it's a very helpful, Mark, to be sure that when we're looking at something and having good faith that it's going to happen, that it'd be nice to get feedback in order to also give credit to the people who are doing this. So I think that's very important. You're saying we have 8 contracts, but so far I've counted 6. Maybe I've miscounted.
I believe we've done,
There's still a few more.
there's one more.
Oh, one more. I'm
I
sorry.
think we've done 7.
Oh,
My
there,
number is correct.
okay, there might be 7. Oh, yes, you're right. Well, Allen. But it's not 8, right? Because
I threw you off by restarting one I'd done earlier.
yeah,
'cause I
sorry.
forgot to turn
You had me. I thought I might be missing something. We're going to have to report it to the commission as to what's on the calendar. Okay.
We have one
Yes,
last
go ahead.
for today. The last item we have is with a contract with Welch Allen Incorporated. Approval of a new contract to continue existing services in the amount of $1,564,640 with a contingency for a term of 2 years and 9 months from December 2nd, 2022 to 8/31/2025. Solicitation authority is through Vizient, the department's group purchasing organization. The previous contract presented to the Health Commission was with Barty Diagnostic, which was bought by Hillrom. Hillrom is now selling the same product and services under Welch Allen Incorporated, the contract in front of you. The department is requesting approval of this. It represents an increase of $311,552 from the previous contract due to the length of the contract term from 2 years to 2 years and 9 months. These services are for a purchase and service of a Carnation Ambulatory Monitor, or CAM, which is a wearable device that records patients' ECG data. If you have any questions, Rosalie Ferrer, Director of Nursing for Medical and Surgical Specialty Clinics, is here to respond.
Oh, I don't have any questions on that. So, okay, so it's 7 contracts because we've dropped the St. Mary's, right?
Yes.
Yes. And that was such a small one all the way up on the top. I kind of missed it as we were counting. But thank you. I think I have enough information to be able to report back to the commission the substance of what we're asking them to approve.
And I will report back to you, Ms. Ruggles and Mr. Goodwin, if there's any issues with approval of all those, all 7 contracts. But our expectation is that will move forward.
8 contracts.
There's 8, actually.
I'm sorry, 8.
Thank you.
Sorry to add confusion. Well, the Chinese hospital is not going to be, remember, it'll be delayed, right?
Right, there were 9, and now there's
Oh,
8.
no, I'm sorry, okay.
Number 9. Okay,
With
let's go through
9
which are
with
the.
Chinese hospital.
Okay, so Lutheran Social Services was 1, right?
Yep. And then Shanti Project,
The Shanti Project would be number 2.
the Registry Network,
The Registry Network is number 3. Okay.
Curry Senior,
Curry Senior is number 4.
Episcopal Community,
Episcopal Community, okay, number 5.
Health Right 360,
Okay.
Outright 360 is number 6. Okay.
summarize that. The Mission Council on Alcoholism was number 7,
okay.
and this was number 8.
All right, 7, and then Welsh Allen is number 8. Okay, we're I just don't want to be sure that we're missing something. That's all.
Yeah, I think.
No,
we-
thank you. Appreciate that.
And
And
thank you all for your flexibility today.
thank you very much for putting up with me individually. We'll try to convey the substance of our discussions here and ask for the approval of the commission. Thank you.
Thank you both.
Take care, everybody.
Thank you.
Take care.